The donation process, how it really works. Many organ donors are victims of fatal head injuries caused by car accident, gunshot wound, or stroke. Paramedics and emergency medical technicians, known as EMTs, begin life-saving efforts at the scene of the accident. The patient is then transported by helicopter or ambulance to the hospital. Doctors and nurses have advanced medical equipment ready when the ambulance or helicopter arrives. They evaluate the patient's injuries and continue life-saving measures. When the person's vital sign stabilizes, he or she is then transferred to the intensive care unit. A doctor performs a series of tests to determine how much damage has been done to the patient's brain and body. During these tests, the hospital staff continues advanced medical treatment. In many cases, patients survive. In some cases, patients don't. Most people aren't aware that death happens in two different ways. Cardiac death, the most common, is when the respiratory and circulatory systems stop functioning. The heart stops beating. Brain death, which occurs less frequently, is when the blood flow and all brain activity cease. In fact, only 1% of all deaths in the U.S. happens in this manner. Brain death occurs when the damage to the brain is so bad it stops working permanently. Unlike a coma, in which a person can recover, brain death cannot be reversed. Brain death is death. If brain death does occur, the hospital contacts the Organ Recovery Agency, in this case, Lifebanc. Lifebanc will go on site to the patient and evaluate their medical suitability as an organ and tissue donor. It also accesses the Ohio Donor Registry to determine if the individual is a registered organ, eye, and tissue donor. After the doctors have spoken with the family and told them of their loved one's death, a member of the recovery organization, like Lifebanc, works with the hospital to discuss donation with the family or legal next of kin. Once consent for donation has been confirmed, the donor's blood type, tissue type, body size, and location are entered into the national computer system maintained by the United Network for Organ Sharing, also known as UNOS. Similar information about patients awaiting transplants is also in this system. These criteria, as well as medical status of the potential recipients, are used to determine the best matches for the organs. Recipients for bone, corneas, and other tissue may be found later. Lifebanc, or the Area Recovery Organization, works with the hospital staff to coordinate the surgical transplant teams and schedules the operating room for recovery of the organs. Bone, eye, and other tissue recoveries are performed by trained medical technicians and occur after the organs are removed. The recovery of organs and tissue is a respectful procedure and is done in the normal surgical manner, like any other surgery. Great care is taken to maintain the normal structure and appearance of the donor. Traditional funeral services, including open casket viewing, may follow if the family desires.